Hello everyone, and welcome to Rethink, Your Life, Your Choice. We bring together community leaders, advocates, and local residents like you to find solutions for better health where we live, work, learn, and play. I'm Sarah Wright, your guest host for today. Thank you for joining us. Today we're talking about nutrition, a topic near and dear to my heart. Improving access to affordable, healthy foods is a priority of Rethink, and there's lots of things that our coalition partners and our health department staff are doing to make it easier for people to make healthy choices when it comes to food. I'd like to welcome our first guests, who are my colleagues at the Winnebago County Health Department. Barb Sheldon is a registered dietitian and director of our Women, Infant, and Children program, which most people know as WIC, and Meghan Herman is a WIC Nutritionist. Thank you both for being here today.
Well, thank you for inviting us.
Yes, thank you.
Great to have you here. So Barb, could you explain a little bit more about what the WIC program is for our viewers and listeners?
Well, Sarah, I'd be happy to. The WIC program is a USDA or Department of Agriculture program that is made available to families with low to moderate income. And the benefits include food, but also nutrition, health, and breastfeeding education and counseling, and referrals to other community services, including other services that are offered by the health department, like car seats and vaccines. The foods that are provided by the WIC program were chosen for their nutritional value, to supplement certain nutrients that women need when they're pregnant or they're breastfeeding, and for infants and children. And they also follow the dietary guidelines for Americans. So I'd like to just list some of those foods, and I'm going to refer to my list because it's gotten to be quite a list.
That's awesome.
So we provide fruits and vegetables. There's peanut butter and mature beans and peas, and iron-rich breakfast cereals, whole wheat bread, brown rice, whole wheat and soft corn tortillas, milk, eggs, and 100% fruit juices. We also give some extra items to women who are fully breastfeeding. They are also eligible for canned salmon and tuna and cheese. And infants that aren't breastfed or are being supplemented can get infant formula. And at 6 months, when the Academy of Pediatricians say it's time, we also add in some fruits and vegetables and cereal. And for fully breastfed babies, they also can get the baby meats. Later this year, there's going to be a revision of the food list, and we're going to be adding in whole wheat pasta and yogurt for some of the participants that are served by the program. And we also have breast pumps available for women who meet the criteria for getting those breast pumps.
Awesome. It sounds like some really great foods in the WIC program. And I understand there were some pretty significant changes made last year to WIC to make it easier for people to get their benefits. Is that correct?
That is correct, and we were very excited that we were finally able to roll out this new way of shopping for your WIC foods. We do use the retail system or local grocery stores and pharmacies for people to spend their benefit. So we do put dollars into the local community. And in the past, this was done through paper checks that had messages written on them that would say the quantity and the type of the WIC approved food that could be purchased. Well, over time that kind of got to be an outmoded way of doing business as other payment systems became available. So we in 2015 adapted an electronic benefit system or a kind of like a debit card that we refer to as eWIC. And instead of having multiple checks that families would have to spend at the store, they have a card that they use that they swipe and enter in a PIN number. So it's one transaction per visit rather than multiple checks per visit that required a separate transaction. And what we do then is we provide the family with a shopping list when their account is loaded, and they take that to the store so they can see the quantity and type of foods that they can buy. And then after they've purchased, they get a receipt from the store so they can keep track of what's left in their account for the remainder of the month. So when they go, they just have that one transaction. They swipe the card, enter in their PIN number, and it just moves the line along more efficiently for the cashier and for themselves and other customers. So it's much more efficient. And the way that the foods are recognized, the scanner looks at the UPCs and the PLUs, and so that's what's determined what can be purchased with their WIC card, and it matches up what's in their account with what is on the belt at the store.
That sounds like a great way to get their benefits.
Yeah.
That sounds like a really awesome improvement. And I
Yes.
understand that nutrition education is also a component of WIC, correct?
Yes, it's a very big part. It's kind of why the program was created, to get some healthy foods into the homes of families that might not normally be able to afford it. So as Barb mentioned, all the different foods that are on the WIC program, they fit a nutritional need. So they each have a nutrient that's important. A big one that we focus on is iron. So that helps children learn and develop appropriately. So we like to make sure our pregnant women start off with a healthy iron count to make sure that baby does, and then going forward. So we test their iron and make sure that they have that good iron level. And then of course, just depending on what client we have in our office, that nutrition education focuses on their needs. So we talk to them, we counsel them with their health and what they're eating to kind of take a look and see what needs to be talked about.
Sounds like that really helps them to be able to make those choices. And can you talk a little bit about the farmers market?
Absolutely. So we're lucky to have a farmers market program, another state program, or not, WIC is federal, but the farmers market comes into the WIC program. We get to hand out $20 worth of checks to our families so that they can go to the farmers markets and other local fruits and vegetable stands. We kind of work with the families, give them a list of what's in season, what months, so that they kind of get familiar, and then also giving them a list of locations, times, and dates of the farmers markets and fruits and vegetable stands.
Fantastic.
So.
That sounds awesome as well, and we're heavy into farmers market season right now.
Yes.
So, well, thank you both for being here today and giving us this in-depth look at Winnebago County WIC program.